is what do we do about the substance abuse and those things, and that has to do with insurance. That has to do with people getting not just the legal services, but the support they need for the young person who does it once or twice and gets caught. And then what are we going to do about that person? So we have to look forward to not only the insurance part, but the support services for the mental health and those sorts of things. Our next speaker is Ms. Laura Colbert. She's the Executive Director of Georgians for a Healthy Future. Sounds good. Our advertisement, we had one of her assistants, Jamila, was going to be here, but things changed at the last minute and we got the boss herself. So without further announcement, I'd like to introduce to you Ms. Laura Colbert.
Thank you. You guys might, by the end of this, be preferring Jamila as opposed to me, but I'm going to do my best to provide you guys with some good information and answer your questions at the end. I appreciate Mr. Posey and Sheriff Neal's presentation. Substance use prevention or substance use disorders is something we do a lot of thinking about and work on at Georgians for a Healthy Future. We're working with our partners at the Georgia Council on Substance Abuse to really think about how to, as Rich was saying, how to make sure that youth, adolescents, who start using or are thinking about starting to use substances, how they have the supports to either not start in the first place or to recover from addiction or substance use after the fact, and really thinking about how do you integrate those supports into schools and into the healthcare system so that they're there when people need them. And so that was just really good information for me to hear and take back to our team as we're thinking about kind of how to be most effective in that area. So Georgians for a Healthy Future, we're a consumer health advocacy and policy organization. We're nonpartisan, and we work on issues related to healthcare cost, quality, and access to care. And so essentially the way that's kind of a big fancy term for saying that we're lobbyists, but instead of lobbying for hospitals or insurance companies, you guys are our clients and really specifically vulnerable populations across the state. So communities of color, low-income families, children, people with disabilities. We really are thinking about how to make the healthcare system work best for them and for all of you. Tonight I'm going to talk a little bit about what's happening at the federal level. Most of our work is at the state level, so then I'm going to talk a little bit about healthcare issues that may come up in the legislative session starting in January, and I'm going to do all that in less than 15 minutes. Especially the federal stuff, I'm just not going to spend a whole lot of time on because it's likely to change probably tomorrow or tonight. So I'll give you what's happening now, and then we can adjust from there. So let me know if anybody gets breaking news alerts on your phone and something I've said is inaccurate. So you may have read that today the House passed their tax reform bill, and tax reform is not normally something that Georgians for a Healthy Future does a lot of worrying about. We don't really have to think about taxes generally in healthcare. However, the tax bill is really a healthcare bill at this point. It's got a lot of healthcare provisions in there and a lot of things that are going to impact access, cost, and quality of care that I want you guys to know about. Specifically in the Senate plan is actually even more related to healthcare. The Senate plan includes a repeal of what is called the individual mandate. And what that would do is it would repeal the Affordable Care Act requirement that all citizens have some kind of health care coverage. That's not a popular provision of the ACA. None of us like being forced to do things that we don't care for. I've heard statistics that people like doing their taxes more than thinking about health insurance. So I get why this provision isn't that popular. However, repealing the insurance mandate really messes with our health insurance market in a way that it does impact all of us. So what it would do is cause, over about a 10-year span, cause 13 million people to lose their health insurance, primarily because prices would be going up, because the only people left in the marketplace would be those who really need health insurance, those who are sick, those who are chronically ill, those who really need that protection, and what that does is drive up premiums for everyone else. So as a result, we would see millions of people lose their insurance. The Senate plan also has an automatic $25 billion cut in Medicare. There is a way for Congress to prevent that cut from happening, but they have to take action. This is a little bit like sequestration, if you guys remember that debate, that Congress said it'll never happen, and we currently have sequestration cuts right now because they didn't do anything about it. So they're making the same promises about Medicare, that these cuts will never happen, they'll never happen, we would never let that happen. And so, needless to say, we're very worried about it because we don't think Medicare has an extra $25 billion to be cut out of it right now. And it also sets up, essentially, it sets the groundwork for future cuts to Medicaid as well. And for Medicaid is a less well-known program. Medicare, as you might know, covers folks over 65 and some people with disabilities. And in Medicaid, it really covers, in Georgia, it's primarily children. 2/3 of our program is children, about 1.3 million of them in the state. And then also seniors and people with disabilities, and some very low-income parents are covered by Medicaid. So yeah, these are folks who really need their health care coverage, who really need insurance, and this tax plan really sets up the groundwork for big cuts to Medicaid because we wouldn't have the federal revenue to pay for the program in the way that it needs to be paid for. So we're concerned about that, and the House passed their tax bill today. The Senate is looking to open up floor debate right after Thanksgiving. Both Senator Isaacson and Senator Perdue will be home over Thanksgiving break, and I encourage you all to call their local offices and let them know how you feel about the tax plan, and that from our perspective, we would ask them to oppose any tax plan that results in healthcare coverage losses, and really any bill that results in healthcare coverage losses. So I encourage you all to seek out your senators over the next week or so while they're home. And so that floor debate will open up after Thanksgiving, and then if it passes the Senate, then the House and Senate will go to a conference committee, and they'll work out kind of the differences between the bills, and then it would go to the president for a signature, and they're hoping to get that done before Christmas. So again, time is of the essence. Tax reform is great, but if it's going to reduce people's access to care and push up premiums for everyone, that's not the positive kind of change we want to see at the federal level. So federal stuff. I'm going to move on to state things. I think that's really where our bread and butter is. We really think a lot about state health policy at Georgians for a Healthy Future, and so I'm going to give you guys just kind of an overview of what's been happening, especially among our legislature. Who's you guys' state senator and state rep up here?
Steve Gooch is our senator.
Okay, Senator Gooch.
And Terry Rogers is most of our representatives.
Okay, great. That's good to know. I don't know if any of them are on the study committees I'm going to mention, but I would have to double check, so I'll look at that. So if you may or may not know that our state legislature meets for 40 days at the beginning of the year, so it starts in January and usually runs through late March, sometimes mid-April. And so in the off session, our legislators create these study committees or task forces so that they can look at issues a little more in depth with more than 40 days time to really consider it. And as we all know, healthcare can be quite complicated. And so it often is helpful for people to have for our legislators to be able to fully hear from stakeholders, to really get feedback, and to really think about some of these more complicated issues. So the couple of task forces and study committees that are meeting right now, the Lieutenant Governor has his Healthcare 360 task force, and they're really looking at a number of issues across the state. Rural healthcare, they had a session on the opioid crisis. They're looking at how to provide better preventive and primary care across the state. They're just kind of doing a whole kind of healthcare landscape in Georgia look. And some discussion that's come out of that is about Medicaid expansion, or sometimes you hear it kind of discussed as a Medicaid waiver here. And is everyone familiar with Georgia's option to expand Medicaid? I see some nodding heads. I don't see a lot of nodding heads, so I'm going to explain it really quickly. So through the Affordable Care Act, every state has the option to expand their Medicaid programs up to include all people under a certain income level. And in Georgia, that's about $16,000 a year for an individual, or about $22,000 for a family of 3. Yep, that's my math. Yep. So essentially as I mentioned before, our Medicaid program covers children, people with disabilities, seniors, and some very low-income parents. And by very low income, I mean less than $7,000 a year, like very low income. And if you are a childless adult or if you're a parent above that income range and you don't get employer-sponsored health care coverage, but you also don't make enough to purchase health insurance on the Affordable Care Act marketplace, you're stuck in what we call a coverage gap. And the Affordable Care Act was set in such a way that Medicaid was supposed to be expanded in all states to cover those people in the coverage gap, to cover those parents, to cover the childless adults who cannot afford private insurance on their own and don't get it from their employers. And 33 states now have chosen to expand their Medicaid programs. Georgia is not one of those. And so we have about 650,000 adults living in the state who are uninsured with no pathway to coverage. And so this is an issue that keeps arising in our state. We've had a number of rural hospitals close, as you all might be aware. We have a very high uninsured rate compared to the rest of the country. Our health outcomes are very poor. We have one of the highest maternal mortality rates in the country as well. And part of this is driven because we have a large percent of our population that do not have access to the healthcare system other than in an emergency when they can go to the hospital. And otherwise they're kind of locked out. Clearly I need to move my hands less, sorry guys. So otherwise they're kind of locked out and they don't have a way to access the care they need. And so Medicaid expansion would close that gap, provide these people with the healthcare coverage that would give them access to the healthcare system in the way that so many of us have access. And Medicaid is a really efficient way to do it. For every dollar the state puts in, the federal government gives us $2 back for that program. And actually for the expansion population, for every dollar we put in, the federal government will give us $9 back. And so it's a really good investment for the state. It would require a little bit of state expenditure, but again, we would get a lot of those dollars back from the federal government to ensure that our population really has access to healthcare services in a way that would help improve health outcomes, help prevent some of these mental health and substance use disorders that we're seeing across the state. So that's come up a little bit in the Lieutenant Governor's Healthcare Task Force. It has also come up in the Homelessness Task Force, which this Homelessness Study Committee. They kind of looked at a lot of aspects of homelessness, and I know that we think of homelessness as being kind of an Atlanta or Savannah area problem, but there are homeless people across the state, and healthcare is a big issue there, as well as a number of other things that study committee has talked about. And then there are 2 study committees about barriers to access to care. There's one in the House and there's one in the Senate. The Senate has really looked at the provider shortages across the state. So do we have enough behavioral health providers? So when somebody needs to go see a mental health therapist, is somebody there in their community that they can go see? Or is there a substance use treatment facility nearby in communities? Are there enough primary care doctors? We know that in a lot of these rural areas in the state that they don't have access to the same number and level of providers as those of us in metro areas. And so that study committee is really looking at those provider shortages and what we can do to kind of resolve some of those. And then the House Study Committee is looking at a lot of our chronic health outcomes, diabetes, HIV, some of these health outcomes that Georgia is just ranked really low among the states for. We're 49th, 50th in a lot of these chronic health conditions. And so the House is really looking at what will it take to address some of these and to help create a healthier population and a healthier workforce. And also to help, of course, drive down healthcare prices, which is something we would all like to see. And then finally, we've got the House Rural Development Council, and they're kind of taking a big, broad look at how to close the gap between rural areas and urban areas, and a large part of that discussion has been healthcare. It's also included technology and transportation and a couple of other issues, but they've had a big and robust discussion about healthcare and, again, how to bring adequate healthcare to rural areas outside of big metro areas. So those are some of the issues we think are going to kind of come up in the state legislative session in the spring. We are certainly hopeful that Medicaid expansion will be if not passed, at least very high on the priority list for legislators. I think that they are more and more aware that this is something that our state needs to do to help address a lot of these health issues across the state. But it being a statewide election year, it may not be the most politically palatable thing to happen this year, but certainly we are going to push and advocate for that as much as we can, because it is, while it's not a silver bullet, it is the biggest step forward that our state can take as far as improving health and increasing access to care for a lot of communities and a lot of people in the state. We will also be looking at the Medicaid program, the federal, sort of the traditional Medicaid program, so less the Medicaid expansion piece. The federal government has given states a lot more flexibility on how they implement their Medicaid program, and that flexibility comes with some risks in that there aren't as many protections for the people, again, mostly children, that are covered through our Medicaid program if there's less oversight. And so we're concerned that we're just going to be keeping an eye out to make sure that our state doesn't roll back any kind of services or put up barriers to enrollment, like having to re-enroll twice a year instead of once a year. Every kind of step somebody has to take to get through their insurance enrollment it causes people to kind of drop out at some point. And so especially when we're talking about children and seniors and people with disabilities, we want to make sure that Medicaid is strong, the Medicaid program is strong and robust and is going to be there for the future. And then finally, we will also be looking at some things in the private health insurance space that at the state level. So making sure that consumers are protected from surprise out-of-network bills. Has anyone here ever gotten a surprise medical bill that you thought you went to an in-network provider and maybe you actually went to an out-of-network provider? So this is something we're seeing a lot of. So this happens, for example, most frequently in emergency situations. Somebody will go to an emergency room at an in-network facility, and then all of a sudden they've seen an out-of-network doctor and they had no idea because they thought they did the right thing and they went to their in-network facility, their in-network hospital. Well, not all providers are in-network, even though you're in an in-network building. So what we would like to see is have consumers in those situations held harmless, and then the insurance companies and the doctors would have to work out payment on their own. And right now, the consumer is left in the middle to fight this battle between these two, and we just don't think that's fair. They don't have the same information, they don't have the same resources. You guys don't have time to be doing that, and we don't think you should be burdened with that either. And so we really think that in the situations where consumers have done their homework and they're, have really tried to go to a network facility, that they would be pulled out of the middle and not be left with the bill. And in addition to that piece of the private insurance space, we'll also be making sure, or trying to push equitable coverage between physical health and mental health services. There's already a regulation at the federal level, or a law at the federal level from President Bush that was signed into law to make that happen, but at the state level we need some regulation and some enforcement mechanisms, and it's just not being implemented well here, and so we would like to see some changes at the state so that when you purchase your health insurance coverage and it's supposed to cover mental health services, that it really does, and it does it in an equitable way to those physical health services that you need. So I think that's it. That's where I'm going to leave it, and I'll answer you guys' questions later.
Thank you.